you know, I found it interesting even when we went through the training, the range of experiences even amongst the group that was going through how this is done and so on. In my situation, I was a totally healthy 49-year-old. I was doing a lot of travel and so on, and I was, in retrospect, because as much as I mean, I've worked with the pharmaceutical industry, I come from a doctor's family, I knew absolutely nothing about ovarian cancer, nothing, other than Gilda Radner died from it and, you know, a few other celebrities. In retrospect, I did have some early indicators, and this was in June and July of 2001. I was having some unusual menstrual symptoms. I was having some bloating, which I'd never had before, and although I didn't connect this at the time, I was acutely tired. I was doing a lot of international work, and I just blamed it on that. But it had never happened before, so it just didn't, I didn't put that together. Now, I did not have, I just assumed that I was going into early menopause. I was going some of the early signs of menopause and so on. I did not have a relationship with a gynecologist. I'd just been having my GP do my pap smears for probably the prior 7, 8, 10 years. So once I got back from my various travel, I started checking into, and I didn't feel any sense of urgency, a real sense of urgency. I wasn't going to let it go forever. Called some friends of mine, business owners, former nurses, and so on, and got a great recommendation for a gynecologist, set up an appointment. Went in, and she did an exam, and she agreed that I probably was going into early menopause, and she palpated what she picked up as a fibroid. And I wasn't in any pain. It was just kind of this pushy lump. I didn't know what it was. Now, she did say, because I was probably going through some of this, that I should come back and see her in about 3 months. However, that if anything changed, I should call her and come in right away. Within 3 weeks, I was only putting on skirts with elastic waistbands. Okay? So I called her, and it was on, I think it was on Friday. She had me come in on Monday. Then they did the ultrasound, and what had palpated like a fibroid was actually the ovary, which was about this big, not causing any pain. It imaged like I guess they call it a dermoid cyst. She was pretty sure that's what it was, and says, yeah, it's got to come out, and so on. And so we went through this, but she said, just to be careful, I want to run a couple of blood tests. This is a very good gynecologist, thank you. She ran a CA-125 and one other, I don't know what it was, and called me back. I was actually in for the pre-op, because after I got over the shock of this, I said, let's get this done sooner rather than later. She didn't seem, I mean, she said it's got to get done reasonably soon, but it wasn't like it was super urgent. And so the CA-125 was high, although not drastically so. It was about 300, but again, it wasn't like off the charts over 1,000. But that because of that, and again, this goes to what Teresa was saying, she wanted to have a gynecologist do the surgery with her, because she says, I see these things, but he sees them every day. Now, she could very well have saved my life right then and there, because they went and did the surgery. It still did not come up positive in the initial sections, but when he looked at it, he said, this doesn't look right. And they went ahead and did a total hysterectomy. 3 days later, final path, ovarian cancer 3C. Friday of Labor Day weekend of 2001, think about the timing. And so I go home, you know, they tell me this at 3 o'clock in the afternoon, send me home. I'm hurting, I don't have any contacts, I don't have any information, and they plan to start chemo the next week, because I was otherwise in pretty good shape physically. I did all my, my checking, called friends of mine. I know people in the faculty of the med school here, asked about the gynonc I was seeing, all this stuff. And what he said to me, he said, you can check stuff out, but there really is a gold standard treatment, and it's carboplatin, Taxol carboplatin at that point. They weren't doing the internal type of administration like they are now. So I called the gynonc during the weekend. He did offer that, because when you're first told this, you're just like, I mean, unless you've had some suspicions or you know something about it. And I started chemo. I would go into my gynonc with my questions, and I would write them down, and I would actually say, encourage your patients to do this, because when you're in front of somebody, they say, you have any questions? Well, no. And then 5 minutes later, they remember everything they've been thinking about for the last 2 weeks. And it can be somebody that's very articulate, but at that moment it just goes away. And he was perfectly willing to answer those questions, which was very important, whatever time it took. And it usually wasn't that much, but it gave me a feeling of control. And believe me, the big C in many ways is not cancer, it's control. Because you lose control of everything at this stage, everything. And one of the things that was really important for me, I own a business, and I obviously wasn't going to be doing a whole lot of international travel at that stage, but I had a project that I was working on up in New Jersey with Shearing Plow, where I was able to either take the train or drive. I was doing my best to avoid infection and exposure to people, as much, you know, in very crowded situations. And my chemo was getting off schedule because of very, very low white counts, and they obviously can't go on with it. And I had everything scheduled around this. Now, think about it from the doctor's standpoint. He was fine. My CA-125 had dropped and so on. For me, it was a huge problem. Now, he can't read my mind, so I actually brought this up and said, what about, at that time, Neupogen? And he said that would be fine. And the insurance company agreed. Obviously, they're on balance. It may be expensive, but it's less expensive than having somebody in the hospital with a generalized infection. And so I got through the chemo pretty well. You obviously lose your hair, but they pre-treated for nausea. I had some neuropathy, but it wasn't really severe, and it came on kind of later. So I guess I wouldn't say I've glided through. It was tough. It's very depressing, though. You feel like you're just out of it. You just don't feel like you're part of anything. One of the after effects that I found was you're just obsessed with your counts for, I don't know, 6 months or a year. You're just like, you're looking at them every day. Now, it's only been done every 2 months, but you're still out there. And it's kind of, you're no longer doing something about this. So now you're just sort of counting on it doesn't come back. So, so I came out of it really pretty well. I was 49 when I was diagnosed. I'm now 57. And one of the things that I did afterwards is I was looking at some work, and I got involved in an NCI proteomics study where they're looking for the proteomic fingerprint of relapse. Now, what does that do? First of all, it keeps me in touch with the best of the best. It keeps me on a schedule of checks and so on. That's fantastic. If I ever did have a relapse, I know I could go right to them and say, what exactly should I do and who should I see? And I now have taken another step. I'm actually serve as a patient advocate for the gynecologic oncology group in terms of their study reviews and so on. So, because many of the people who were diagnosed at my stage at the time that I was diagnosed aren't here, I guess we're kind of here to advocate for them. So I did have some of those symptoms. I had some of the classic ones: acute tiredness, the bloating, and very few other things. I didn't know anything about it. And the other thing, and this is a message that I would second what Teresa said, even though I wasn't planning on kids at that stage, I would have been better off had I been seeing a gynecologist all along, because she would have then known that that lump had developed in a very short period of time, and she would have recognized that immediately that it wasn't a fibroid, even if it palpated like a fibroid. So that was the message for me, which I talked with her about after that fact. So subsequent to that, I went on, and that year that I came out of chemo, I saw a little thing about having a sprint triathlon for the over 50 bunch, and they were going to do some training and so on. I decided to do that, and I've gone on from there, and in about 3 weeks will be competing in a national championship level half-iron triathlon. So it's become quite a, I guess you have to call it an obsession. But it feels great, and I'm in great health, and my CA-125 stays below 10 consistently. So that's kind of the story.